Today we're going to talk about a very big issue, a big deal. It's heart disease. You have many names, even about heart disease alone, okay? For a normal person, even you in the daily life, you can see a lot of tragedies happen. That is called heart attack. You see, that means a sudden attack, okay? Now for common sense, what we learn from our education is for when facing this kind of heart attack, sudden heart attack, you use what do you call CPR, okay? That is, you kind of press down here the chest, you see? Yeah, it's here. Not many people you know, okay? This is the mainstream usage or method used everywhere, in every country, okay? But now, I'm going to teach you something new. When you meet this kind of, or encounter this kind of heart attack, don't panic. There is an excellent way. You just do a very simple thing. You can learn it in 1 minute. Right now you can learn it, you can save many lives, okay? What do you do? Just, okay, for the patient or for the one who has the heart attack, just do here, okay? Roll up sleeves here, here. You just do it slapping here. Either the right or the left, both are okay, okay? If there are two persons, you can do both sides, okay? On this patient, see? Of course, when I show you how to do this, it's gentle, okay? When it's in an emergency case, you have to do it really hard, okay? Because we have met so many cases like this. People lost their consciousness already. Lying down on the ground, totally lost their sense. You have to do it very, very heavily. Besides here, you can also do here, okay? If you finish in here, still doesn't work, you can do it here, okay? Well, normally, in just a few minutes, let's say 3 minutes, 5 minutes, you will already see the healing effect. We got a medical doctor who's a medical doctor. She gave us a testimony, okay? She worked in the emergency room for like 9 years. That's what she told us. In that 9 years, she used the CPR. None of the patient was saved, the heart attack, okay? So once in the college sports meet, one 21-year college student fell down, it's a lady, okay? So she said, this time, I used the CPR. I didn't use CPR, I used slapping here. Because that girl lost her consciousness like for almost more than 30 minutes. So she tried this for how long? For almost 40 minutes. And she saved that girl. So it's longer. This is the longest I've ever experienced, I've ever heard. But for the majority of the cases, 5 minutes, maybe 10 minutes the most, yeah. You might still think this is an accidental or exceptional alternative case. What I want to tell you is that this, we have tried on thousands of people. Thousands, okay? It happened in hospital, at home, in a bus, in a railway station, at the airport, even on the road. So far, okay, I'm not sure about the future. The success rate is 100%. I mean, every single one is a success. I personally experienced, I don't know, at least 100, yeah. Every time, here, it worked very well, okay? Why do I think this is a big deal? Because this so-called heart attacks happens everywhere, in every country. And sooner or later, probably in every family, okay? But this is very difficult. I mean, the heart disease is very difficult to be checked out or diagnosed in the hospital through the machines. See, for those who have this kind of heart attacks, maybe some of them know they have these heart problems, but many of them don't even know they have these problems. So this is a kind of strange thing to happen. You don't even know you had a problem. Sometimes, even if you have a heart attack and you are carried to the hospital, through the machine, through all these doctors, they still cannot check out you got heart disease. See, isn't that weird? But I'm sure you have some cases like this. So for slapping here, PIDA here, is not only doing the healing, but also diagnosing. Because through the pain, you can feel you got blockages. Because here, this is where the meridians of heart, pericardium, and the lungs go through. So by doing so, you can feel the pain. The degrees of the pain also shows the degrees of the blockage in your heart meridians. So the more painful you feel, that means the more blockages you have here. Okay, that is pain, you can feel that. Okay. Number two, by slapping here, you can also see what we call the sa, that is the dark color. Sometimes it's not only purple, it's even black. So you can see from that kind of color how seriously those meridians are blocked. Okay. We have another excellent case. Okay, one girl, maybe 10, 11 years old, at home with her grandma. The grandma had a heart attack. Okay, so the girl didn't know what to do. She used the phone to call her mother. So her mother, in a remote control, it's like a remote control. Okay, in the telephone, tell the little girl to just slap on her grandma's elbow, inner side of the elbow. Okay, she tried her best for about 5-10 minutes. Of course, they also called the ambulance, called for the ambulance. So, but in 10 minutes, the grandma already came back to life. So the emergency working staff came, showed up. They said, okay, this little girl did an excellent job. Otherwise, she could have lost the grandma. We have so many cases like this. This is so normal. Okay? What I want to say, see, even the little girl can do it. So, because this is not a medical treatment, you don't use any medicine. Okay? It can be used by anyone, old and young, men, women, and you can learn to do it so easily. Okay? Be sure this is not only for the emergency case. What about the normal heart problems? See, some people will argue, even if I have been to the hospital, the doctors told me I don't have a heart disease. Now I can tell you, when you have some symptoms, you already know you got heart disease, such as if your heart beats too fast. Okay, that's a problem. Or too slow, or irregular, or sometimes you're out of breath, or headache, or insomnia, or you have hundreds of other disease names. You see, read my lips, the names. The names might be hypertension, high blood pressure, or lower blood pressure, or diabetes, or cancer, or insomnia, or skin problems, skin diseases, or even neck problems, frozen shoulders. All these problems, I can tell you now, they have you have different names of the disease. That also shows you have the blockages in the heart meridian. See, I don't even use the word heart disease, I use the word blockage. The blockage is not only on the vessels, on the cardiological vessels, but also, more importantly, on the meridian. Meridian is the channel where the energy moves. So, of course, you can check out from the meridian chart, which is available in the bookstore. Okay, the meridians here are directly linked with the heart, with the lungs, with the pericardium here. So, if you slap here, you're not only slapping the meridians, but also the vessels, and also the muscle, the ligaments, the nerves, everything. So this is a very powerful way of saving people, and it is very useful. You bet. You can even use it today, and right now you can try it here. You can see whether you have the pain. If you don't feel any pain, that means you're very healthy. You're free from heart diseases. If you do have the pain, that means you do have the problems. Number two, you can see the bruise. I use the bruise because in English we only have the word bruise. In fact, in Chinese language we call it sha, S-H-A, which means poisoned blood or toxins. Okay. Once you have this kind of sha, that also shows you have blockages. You don't have to wait until the heart attack really happens. You can do it far before that. Save for rainy day, okay? So much for today. Thank you for your watching.